May I invite the first speaker in this interesting session, Professor Evgenya Patrakeeva. She is a teaching assistant in endocrinology and consultant endocrinologist at the first stationary St. Petersburg Medical University. She is the member of the advisory board of the education site for Russian diabetologists. She is a very eminent speaker, and actually her talk also is very interesting to me, and I think to yourselves, since we are in the era of technology. Her speech is going to be about internet, media, social networks. I think this is very interesting. We are looking forward to hear you, Professor. Go ahead.
Thank you very much for a nice introduction. Do you hear me well enough, dear colleagues? I am very happy to be here in this beautiful city, in this beautiful place. And next 20 minutes we will discuss something about the internet and in a very innovative way in diabetes care. And tomorrow also we will have a talk about diabetes care in digital era. So it's very close to this one, but it's like an invitation for you to be with me also tomorrow. Just before we start, I want to say that if you need something from this presentation, just slides or pictures, you can just write me by email, which is written here. Don't hesitate, please. And let's start from some history. Again, as all of you know, of course, we have a great transformation of illness when we're thinking about our patients. Of course, before insulin, there are some sort of problems. After that, another problems. Of course, later, with knowledge of pathophysiology, we have some great results. And now we have multifactorial treatment, large studies, a lot of information, but we also still have a dream that our patient will take care with some sort of great resources, internet resources, also with social media, because for them it's very important to live their modern life. Of course, there are some new development in diabetes, new insulin, beta cell replacement, complication treatment, a lot of novel modalities here, applications, social media, artificial pancreas, immune intervention, smart insulin, online initiatives, future treatments, even virtual clinic close to telemedicine. We will discuss it tomorrow. And we will talk also about some sort of continuous glucose monitoring system and insulin pump, new version of them. Of course, there are some future treatment of diabetes. I just tried to keep some here. But also you need to remember about these points here, because there are still a lot of new initiatives in this field. Of course, there is a great evolution in blood glucose monitoring system, in sensoring of glucose level, not only in blood, as you know, but also all of us as doctors need to remember about human factors in technology. There are some of human factors in diabetes care that can be overcome by technology. There are fear of hypoglycemia, numeracy literacy, data overload, excessive time requirements, technology literacy, device incompatibility. So there are still some problems here. And of course, social media can help us as doctors. Is it a great surprise for you? For me, not now, because of course, sometimes we're tired because of social media and their influence on our life and on life of our patients. But also, right now, we have some data about social media and diabetes care. Individuals are increasingly turning to social media. Is it true? Yes. Of course, 1 in 4 internet users living with a chronic health condition go online to find others with similar problem. Is it true? Yes. And of course, there are a robust online community of diabetes patients, and they are strong enough, they do a lot, and they change their lives, and we discuss it later. There are some data about social media, and if you go to PubMed and try to find information, there will be a lot of studies there about improvement of hypoglycemia management, as for example, motivations and social media, also about patient diabetes communities and their influence on the patient's life, even about social media as a space for support, because it's very important for our patients. if you're trying to understand what do our patients trying to find there, and there's an interesting study about one Facebook group about Night Scout. It's like sort of technology in diabetes. And you can look here and understand that all the patients try to find information about disease, about technological issues in social media groups, which have specialization in diabetes care. And surprisingly, as you can see here, when we imagine our life as a doctors and our meaningful for patients, we always think that we are the best advisors for our patient. But look here, only about information on prescription drugs, patients trust us more. Can you imagine? Because all other things like information about other treatment modalities, recommendation for a doctor, for a hospital, some practical advices, they trust more to the same patients in these online communities like social media. So I think now for us it's time to change our feeling about social media and about online communities of patients, because it's a way to change patient treatment and patient lives. If you try to imagine what kind of patient use social media more, we can just divide them into 3 groups, from higher level of offline support to low level. And of course, children and not independent diagnosis like non-encounters here. There are some patients who sometimes use, sometimes not, social media activities, and some prosumer who are diagnosed at older age, independent perspective, rejected or unable to find adequate offline support, value peer support, and sharing the first-hand experience. So sometimes when we just meet the patient during our consultation, we need to understand, will it be helpful for this patient to use social media? Can you give an advice to go to some online communities or to find information for something? If you will remember this classification, you can just imagine that there are some patients who will greater and greater helpful from social media. What about Russia? As an example, we tried to collect information about our patient and the usage of social media on diabetes. There are some hashtags, you know, it's written in Russia, but just to give you numbers, it's a lot of information about diabetes. If we will use English version, just word diabetes as a hashtag, there are thousands of information with this hashtag. So a lot of information, and we need to remember about the quality of information, and we need to think, is it possible for patient to use it? We tried to analyze the information about the patient who use more social media. It's like a web resource of Russian patients. Here you can see when we tried to ask the patient about the age, we just have a hypothesis that there will be young persons, but as you can see here, more than half patient, it's the age between 26 and 40, so not so young as we can imagine. If we will go for diabetes duration, of course, it's a great number of people with diabetes with not so long period of diabetes, less than 5 years, because they try to find new information in their new life situation. HbA1c level, surprisingly also, it was not so high in the person who used this group. And the very important issue, because the core situation in diabetes care is education, it was unsatisfaction of this patient in typical therapeutic educational process in Russia. So for patients, social media is like an alternative resource to find information, and it can be very important for them. So also important issues. If you try to analyze how often patients use social media, 35% every 3 minutes. Every 3 minutes, can you imagine? After that, we ask how often do you read information about diabetes in social media? Like 55% use social media only because of diabetes. They don't try to find anything else, just information about diabetes. And what kind of information about diabetes do you usually try to find in social media? It's about information from peers, so from the person with the same situation, and sometimes information about healthcare professionals. Of course, the great answer, it was published some years ago, that they can find answer for all questions about diabetes in social media. That's why we have some benefits. Of course, it's about connecting with like-minded people and sharing ideas, opinions about diabetes care, learning from patients, from blogs, vlogs, research recruitment, maybe data gathering. For us, it can be very important, I think, now. And it's possibility to talk to our patients and to educate them. So we cannot ignore the social media resource as an educational thing. Of course, also there are some problems with social media. I don't want to say that all of us must go to social media to use it for diabetes care, because sometimes we just need to go to reality and talk to our patients in reality. There are also like a story about, of course, social media, computerizing, going online, connecting to body mass index. It was a study which performed on 1,000 patients, and here you can just read the significantly great sitting times because they're using social media more. So we also need to remember about it. We can just stress the importance of social media because nowadays we have a special guidelines for healthcare professionals how to participate in diabetes online community. So we need to divide personal things and professional things. Also, we need just do some general, more than some special situation in diabetes care because all patients have their own doctors, so we can just give a great, very straight advice about something. We need to watch and learn because we need to understand what are we thinking about during the social media activity. And of course, we can encourage our patients to do something with their diabetes through social media resources. Of course, there are a lot of internet resources on the field of diabetes. As I think that the greatest example of doing this, it's like the situation with open apps, like do-it-yourself artificial pancreas, do you know the story? When the patients themselves, or it was a story about parents of the patient, find all information about the devices in internet and just do themselves artificial pancreas without any approval of FDA, EMEA, or some other organization because they don't want to wait for some approval. And it's a real story. And it can be done without internet resources, without social media, without possibility to find information about it in internet. Because you know, all these things about artificial pancreas, it's really, really difficult. A lot of people working on this field. A lot of money is going on here, but patients, with support of internet resources, do it themselves. And of course, there are a lot of great resources for our patient. Just a simple example, like if your patient wants to use physical activity and trying to change their insulin doses or something like that, you just can recommend it to this resource. In Russia, we have a Russian version of supported resource from a Russian-speaking community. And as a result, of course, we need to remember that still there are some advantages and disadvantages of health technologies. Here, if you will think about text messaging, and you know this very popular article which was published several years ago about Indian community, they use text messages just to educate patients with type 2 diabetes, and they have a great response in targeting the HbA1c level, even with one text message per day. So we can change everything just this simple thing, just think about it. Of course, if we think about application, it's also a huge story now because there are a lot of applications on diabetes about carbs calculations, about, I know, recipes, about dose calculators for insulin. Of course, there are some still problems with that because they're not supported sometimes by healthcare professionals. Some programs, web-based, also possible to use like a resource for thinking about some treatment modalities. So even games, we can just do this sort of gamification for our children with diabetes who can use this like a resource for education, but in their special way, just to be closer to the treatment things. And I want to emphasize that this will grow because it's access to information, because it's educational resources, And of course, because it's cost effectiveness, there's still not so many data on it, but I know that it will grow, and I understand that you know it too. So as a summary, I just want to say that there are a number of technology to support diabetes self-management. These technologies can have positive impacts on some behavior of our patient, even from age to age, even for old patients with type 2 diabetes or for small children with type 1 diabetes. There are special applications even for patients with gestational diabetes, for pregnant women with diabetes. So it's like positive things. But all of us need to remember that individuals should be adequately trained in the use of these technologies. And we need to know what we can recommend to our patients, because some of these modalities is just not supported by healthcare professional, and the quality of information can be very low. And of course, as I told you, further data on the efficacy, usability, acceptability of the more novel things is required still. So just take-home messages for you. They're very simple, but it's a main story. There are still additional possibilities to educate our patient: social media, internet resources, application, virtual clinics, games, chats, blogs, vlogs, and so on and so forth. And of course, support for our patient is very important, but here you need to remember that it's not only our support from healthcare professionals, it's also peer support, which can have a great role in patient lives. I just want to conclude with this phrase that education is not the filling of a pail, but the lighting of a fire. And I hope that I light the fire in the souls about social media, internet resources, and its great usage for our patient and changing their life. Here again, of course, we're talking about social media, so you can just look here and find me in social media, because we use it for work with our patient. And still, if you need something, just write me by email. I will respond you. Just finalizing, it's a picture of my city, St. Petersburg. As you know, maybe you know, it's a cultural center of Russia, and we have a period of white nights during June. So all of you are very welcome to St. Petersburg, and I hope to see you in my city too. Thank you. Thank you.